A 64-year-old female presents to the orthopedic clinic with complaints of wrist joint pain. Your task is to examine the hand. Hand joint examination is one of the common clinical scenarios which can be kept in clinical skill exams. So, in this session, we're seeing how to examine the hand. We are not going to touch about the peripheral nerve examination, which will be dealt with separately. Now, as with any other hand examination, proceeding with the usual protocol of the joint examination like introduction, confirming the patient's identity, wash their hands, explain the procedure, confirm if there is any pain, and make sure the patient understands like what you're going to do during the examination before you start proceeding. We will then move on to the so in the inspection you need to scan the surroundings, look for any mobility aids, expose the patient. That is, for the hand examination, it's preferable for the patient to be exposed from the elbow or just above the elbow until the fingertips. The examiner usually sits in front of the patient and provide a pillow so that the patient can keep the hands over the pillow. Start by examining the dorsum of the hand and then move on to examine the palm of the hand. Now, what are the things to be observed? We start with the skin. In the examination of the skin over the dorsal aspect of the hand, we look at the color of the skin. If there is any erythema, which can indicate inflammation like acute arthritis, acute gout, any ischemia, thickness of the skin. So, in case of steroid use, there will be thinning of the skin. Any callosities, which can indicate uh, occupational problems. The thick and the shiny skin, which is one of the indicators for sclerodactyly, and the skin lesions. Look for vasculitis, Gauton's papules, which is an indicator for dermatomyositis, psoriasis, in which there would be skin lesions, scaly skin lesions over the dorsal aspect of the hand, and the ulcers. Also observe for the soft tissue lesions like the rheumatoid nodules, which is usually present along the extensor aspects, gouty tophi, usually found in the distal interphalangeal joints, indicating gout, and ganglion, which is usually present along the tendon of the wrist. Observe for any scars, which can indicate the previous surgeries. For example, a dorsal longitudinal scar can indicate a surgery, a wrist fusion surgery over for rheumatoid, or a tendon transfer operation or a surgery over the metacarpals. The hand examination, you need to examine the nails. So look for any pallor, cyanosis, clubbing, which might indicate a cardiovascular problem, splinter hemorrhages, Janeway's lesion, which might indicate infective endocarditis, onycholysis, stitching of the nails, which is usually present in psoriasis, nail fold capillary telangiectasia, and periangual erythema, which are positive in autoimmune diseases like SLE and sclerodactyly. Observe for any muscle wasting. So, dorsal interosseous and the forearm muscles, look for any muscle wasting. Look for any deformity and the swelling. Always go in a particular format, either from the distal towards the proximal, like observing the distal interphalangeal joint, proximal, then moving on to the metacarpal and then the wrist joint, or the otherwise. Ask the the patient to make a fist and observe for the valley between the metacarpophalangeal heads. So this valley will be disappeared in cases of synovitis. Ask the patient to keep the hand in front of the chest with the elbow flexed. Look for any volar subluxation, which can indicate a rheumatoid arthritis. A wrist drop, seen in cases of radial nerve palsy, and a finger drop, usually seen in case of ruptured tendons. We go on to examine the palm of the hand. We will see the usual stuff which we have seen in the dorsal aspect of the hand, like the color, looking for any palmar erythema, which is an indicator for liver disorders, any thickness like calcinosis cutis, any skin lesions like gouty, tophi, pitting of the fingertips, subcutaneous lesions like nodules along the distal palmar crease, any Dupuytren's contracture, and tendon nodules, which is seen in cases of the mallet fingers, scar, is for example a wrist longitudinal scar, which might indicate a previous decompression of the carpal tunnel syndrome, the muscle wasting along the thenar and the hypothenar, and look for any abnormal deformity and swelling. So this is with regard to the inspection of the hand, both on the dorsal and the palmar aspect of the hand. We then proceed for the palpation. Before we go on to the palpation, we will be seeing a few examples. Here, what is this type of deformity? So here you can see the distal interphalangeal joint is flexed. So here this is the swan neck deformity seen in cases of rheumatoid arthritis. Here you can see the proximal interphalangeal joint is flexed and the distal interphalangeal joint is extended. So this is called as Bouchinese deformity, which is also seen in rheumatoid. An Z-shaped deformity of the thumb, where you can see the metacarpophalangeal joint is in hyperextension and there is flexion in the interphalangeal joint. So the Z-shaped deformity also indicating rheumatoid arthritis. And here you could see multiple lesions. So you can see there is a deviation of the hand, the ulnar deviation of the hand of the fingers. The fingers are deviated towards the ulnar aspect. The radial deviation of the wrist. So here you can see the radial deviation of the wrist. So these and volar subluxation. Volar subluxation. So these are the indicators for rheumatoid arthritis. And here you could see nodules in the distal interphalangeal joint and the proximal interphalangeal joint, indicating Heberden's nodes and Bouchard's nodes, so which are usually seen in case of osteoarthritis. And here you can see the telescoping of the fingers, which is usually seen in case of psoriatic arthritis. We then proceed on to the palpation. So in the palpation, we go about seeing the dorsal aspect of the hand first. Look for the temperature. The temperature, check the carpals, base of the thumb, metacarpophalangeal, and then the interphalangeal joints individually. Compare it with the other hand to look for if there is any inflammation. If there is any swelling, palpate over the swelling to look at the how does it feel. Nodules, palpate if it is firm or hard in consistency, and if it is attached to the skin or if it is deeper to the skin. Thickening of the skin can be found by pinching the skin over the dorsal aspect of the hand to check if they are thin or thick. Squeeze test, which is done by squeezing the metacarpophalangeal joint to check if there is any pain. A piano key sign, where a small press is made over the ulnar styloid process And if there is a subluxation, it will be coming back up like a piano key, and that's why this is called as a piano key sign. Check the anatomical snuff box at the base of the thumb. So check if there is any swelling, and press over this region to find out if there is any tenderness, which can indicate a scaphoid fracture. We will then proceed on to movement. So we need to examine individual joints. So we will ask the person to extend the wrist by using what is called as a prayer sign. So just like in prayers, so we will ask the person to keep both the hands together and extend it as much as possible. The inflection of the wrist joint can be found by a reverse prayer sign and keep with the shoulders adducted and the elbows flexed at 90-degree. So ask the person to do wrist abduction and adduction to check if they are normal. Assess the movement of the fingers by flexion, extension, and grip test. In the thumb, look for flexion, extension, abduction, adduction, and opposition. In the metacarpophalangeal joints, look for flexion, extension, abduction, adduction. Check for the pincer strength. So we would ask the person to press the thumb and the first finger and try to remove it. So that's the pincer strength. Look for the flexor digitorum profundus and flexor digitorum superficialis tendon if they are normal. So this can be checked by asking the person to flex the fingers at the metacarpophalangeal joints. So where both the flexor digitorum profundus and the flexor digitorum profundus and superficialis acts. We will then hold the middle phalanx and ask the person to flex only the distal interphalangeal joint, and this is the test for flexor digitorum profundus. We know that the flexor digitorum superficialis gets inserted into the middle phalanx. During their movements, also observe the joint if there is any crepitus. So after this, we will be doing certain functional aspects like asking the person to write a name, button and unbutton his shirt, pour a glass of water, pick a coin from the floor. We will then do the sensory examination over the hand along the medial, that is on the palmar aspect, 3.5 fingers, the radial, which is usually on the dorsal aspect, the ulnar nerve, which is in the medial 1.5 fingers. The power for medial, radial, and the ulnar nerves needs to be checked, and there are certain special tests for the above nerves which we'll be discussing separately in a different session. Don't forget to check the pulsations, the radial artery, the ulnar artery pulsations, the brachial artery pulsations. Also, you need to examine the capillary refill time when you are examining the nails. So with this, we come to the end of the hand examination. You should tell the examiner that we are examining the shoulder and the elbow examination, and a complete neurological examination is needed to find out the exact cause of the problem. Thank you.